The classic sprain is when you roll your ankle. This can be in a different number of severities. It might be very severe, meaning a full tear of a ligament, or it might be very mild, meaning a stretching or partial tear of a ligament. If you sprain your ankle, you can expect to see pretty severe pain, redness, bruising, swelling, and inflammation around that part. Fractures can present themselves very similar to sprains. They will also cause severe pain, bruising, swelling, and inflammation. If you have any doubt as to if you're dealing with a fracture or a sprain, then you should go to a clinic to seek medical help. The only real way to tell between a fracture and a sprain is an X-ray. One of the key signs to a fracture, however, will be local tenderness. If there are specific parts of the ankle, specifically the inside part or the outside part, that hurt more than others, this might be a sign pointing to a fracture. It might also be a sign if that person is not willing or cannot put any weight at all on the injured ankle. The last way to tell between a fracture and a sprain is if there is a type of deformity, or if the leg or ankle doesn't look like it exactly should. Now that we've talked about some of the differences between sprains and fractures, let's talk about how to treat them. The easiest way to remember how to treat them is with an acronym RICE, R-I-C-E. This stands for rest, ice, compression, and elevation. Rest. If somebody has a sprain or a fracture, they'll need to rest this until it heals. Ice. It's important to keep this place with an ice pack or some frozen vegetables from the freezer around the injured area. It's important to try to avoid ice to skin contact because especially if they don't feel this area so well, you don't want them to get frostbite. So put a thin washcloth or a paper towel between the two and make sure that you don't ice for more than 10 minutes at a time. Compression. There are a number of bandages that you can use, like the Jones bandage that we mentioned in the earlier video, to cause a little bit of compression to this area. Have it wrapped securely, but obviously not too tight as so it cuts off the circulation. Lastly, elevation. While this person is sitting and resting, you can elevate their leg up higher than the other leg. If this person has trouble moving this injury or you can't move their leg, you should go seek professional help right away. Before you go seek medical help, make sure that you immobilize the joint or the arm or the leg that you're dealing with, just like we talked about in the last video about dislocations. Let's review what we learned about sprains. Best way to treat a sprain is with RICE, rest, ice, compression, and elevation. If you have any doubt that you might be dealing with a fracture, go seek professional help immediately.